Common ovulation signs you should know. Timely ovulation means a successful pregnancy. At least that's what your closest friends and mom tell you. However, what is ovulation exactly? And why is it so important if you want to get pregnant? What are the most important ovulation symptoms? Today in this video, we'll be sharing the major symptoms of ovulation you should know. Don't forget to like, share and subscribe if you gained value. Ovulation is a monthly process when one of your ovaries releases an egg. After this, the egg travels through a fallopian tube where a sperm cell may or may not fertilize it. This is the main point of a menstrual cycle. What happens after ovulation depends upon whether a sperm cell fertilizes the egg or not. If the sperm cell fertilizes the egg, it moves to the uterus where it plants itself in the lining, resulting in a pregnancy. If a sperm doesn't fertilize the egg, it eventually disintegrates and your body sheds the uterine lining, which you know as a period. Whether you're trying to get pregnant or want to prevent unwanted pregnancies, knowing about ovulation, when it happens, and how you can track it, can help you. In addition, closely tracking your menstrual cycle can improve your ability to know when something's wrong, which is beneficial in diagnosing specific medical issues. During the period, it's possible for you to experience a variety of ovulation symptoms. Each woman feels these symptoms at a different degree of intensity. These are the most common ovulation symptoms. Number 1, cervical mucus changes. For starters, your body will release vaginal discharge much more frequently right before ovulation. This will be different from what you occasionally see. It will be clear and have a thinner consistency. After ovulation, however, your body will release less discharge, which appears cloudy with a thicker consistency. Number 2, heightened sense of smell. If you notice a change in your sense of smell before your period, it's a sign that you're ovulating. Number 3, breast soreness or tenderness. The rush of hormones before and during the ovulation period leads to breast soreness and nipple sensitivity. Number 4, pelvic or abdominal pain. If you consider yourself extremely sensitive to the changes in your body, you may have already felt the ovulation process. You can feel ovulation occur as a slight pain in the lower part of your abdomen. Know that you won't experience this pain on both sides at once and you won't feel it at the same place each time. You'll probably experience this ache, Mittelschmerz, for a couple of minutes or even hours. Moreover, your body may release either blood, spotting during ovulation, discharge or both, upon release of the egg. Medical professionals assure that you shouldn't worry about an ache that subsides with anti-inflammatory medication. Conversely, you should go to the doctor if the pain you feel is severe and doesn't go away even after taking medication. Number 5, light spotting or discharge. Although it isn't common, it's possible for your body to release brown discharge or a little blood, also known as spotting during ovulation. This happens when the follicle surrounding the egg grows bigger and finally ruptures, which causes the bleeding. Unless the spotting continues, there's no reason for you to worry. In case it does persist, you should undergo a checkup to make sure you don't have an infection. Number 6, libido changes. During ovulation, our bodies enter a state of increased libido, but almost anything can influence something so subjective. You may or may not notice this since external factors, like stress, being in a relationship, and other responsibilities can affect your libido. Number 7, changes in the cervix. When your body is ovulating, you can feel some physical changes as well. Your cervix, for instance, might be getting higher. Your cervix and discharge consistency can give an accurate answer as to whether you entered the ovulation period or not, but it'll take some time before you can finally tell the difference. That's because the changes will be hard to determine, and unlike the previous mentioned symptoms, you can't really feel this one. Using your finger, you can feel your cervix change before and during ovulation. You'll notice that before ovulation, the cervix becomes softer, but during the process, it is high, wet, soft, open. After ovulation, it becomes much harder. Ovulation might be a difficult one to track for some women. But with knowing the symptoms to look out for, constant observation of body changes, with time this can be determined. Thanks for watching.